Kianjokoma has been one of the hot spots for GBV.
I know some people ambao wame-experience hii mambo katika hii kikundi yetu ya the different level.
Kama caregiver unaweza kuwa mzazi na unaweza kuwa caregiver mwenyewe. Tuseme ulipata mtoto ako na ulemavu, kama ulikuwa unafanya kazi, itapindi uache kazi ndio upatie mtoto care. Yani ukuwe na mtoto throughout, sababu huyu mtoto anakuanga special, is not like the other children.
The cases that are reported over the year are more than 1,000. Embu and Mount Kenya at large is a hotbed of GBV, and most of the cases go unreported because of even the culture, stigma, wife battering, and also the culture where people show that GBV should be resolved by men, and men are the perpetrators of GBV.
Wakati hatukuwa na this information, watu walikuwa na mashida mingi, kwa sababu ukipatwa na shinda, familia pengine ilikuwa inaketi chini inajaribu kutatua hiyo maneno, lakini ilikuwa inafanywa kinyumbani.
Yani hakuna watu walikuwa na hiyo training, wanajua hiyo mambo ya GBV na kujua venye wanaweza handle cases.
As the cases continue to rise, we realize there is lack of information and awareness on the ground, and also the services are very fragmented. You'll find that there is a police station there offering legal services, there is an hospital there offering health services, there is the church also which provides spiritual counseling and spiritual services, and there is no way to link these resources together. So you find that most of the people will miss the counseling and they will get the legal services from the police station. So after sitting down with the community and analyzing their needs, we saw it was good to bring these resources together, and that is the idea that informed us in developing the hub. We have over 100 users who have downloaded the hub, but most of the people also visit the resource from the website directly.
Hii tool nilisikia kwa kikundi yetu ya Pinda Periodis, na ni app naweza download alafu naweka kwa simu.
There before I was hearing about them, but I was not aware. But now after learning that was going through of GBV, so that I was to attend. From there now I understand that I should be the part of them, so that maybe I can help the community and also the church.
RCDD walitufanyia training mambo ya GBV. Tulisomeshwa mambo ya resource mapping, na mtu akipata mashida ya GBV mahali tunaweza mpeleka ama tunaweza kumsaidia.
In some institution, after mapping, now you can go there and see things are better. There are ramps, kuna watu wale wanasaidia wale hawasikii sign languages, na kama ni institution kama police, kuna room za wale wamedhulumiwa, kuna special room kupitia hiyo app after mapping.
Our resource mapping app is an app that brings together the resources for fighting GBV in Embu East and Embu North, given that we are the border, so the hub covers both the sub-counties. The hub lists all the resources and the information about the GBV that can be accessible by the people who visit our RCDD website, and also the people who have the hub installed in their phones themselves. The hub basically is a resource map center where people are able to check. You can check if it's a legal service, if it's an health service, if it's also a counseling service, and all those things that are in aid of people who are in the line of GBV. That is basically what the hub covers.
The tools as influence, one by creating a pathway or now somebody can able to see a case and report without any convenience.
Hii application I've ever used it, I was mapping this public institution. Una map ndio ujue uko aje, especially on the side of Pinda Periodis, whether the institution are friendly. Right now, I'm able to approach watu wengi. Kama ni wamama wale wako na watoto, you are able to approach them, talk with them, unawaambia where you can take your child.
Kwa sababu kuna watoto ambao hawakuwa wanapelekwa physiotherapy. Na wakati tulisoma hii mambo ya hub na mambo hii ya mapping, walisikia hii maneno na wakaichukua kwa undani sana. Na wakiingia kwa hiyo hub, wanajua ya kwamba Kianjokoma kulikuja services for physiotherapy services. Sasa wakajua na wakaanza kupeleka watoto for physiotherapy. Na wao watoto siku hizi wengine wanaanza kuendelea vizuri katika biashara zao.
The core mission of our organization is promoting human rights and disability of the marginalized in the society, specifically the PWDs. We have a specific focus on PWDs. 3 out of 5 of our board members are PWDs, and also 2 of our staff are PWDs. But we do not only focus on PWDs, we focus on the youth, the women, and also the young girls. And on areas that we cover include the areas of GBV, economic empowerment, and also social inclusion. To improve the system, we are thinking of integrating it probably with even the broader public system. Yeah? The system has a public portal where even people can access information, but I don't think most of the people are still yes used to that aspect. So we think of even looking at technologies like disability assistive technologies, because they're one of the groups that are most affected by the GBV. And you find that someone with a disability, for instance, our app doesn't have like visual aids for people with visual hearing aids, so they have to have someone report for them, which also breaks the confidentiality that we are trying to enforce for survivors. We are going to improve that. We are also thinking of maybe how we can integrate these technologies to the app so that people with disabilities, like those with visual challenges, hearing challenges, also can be able to access the app directly without the intervention of another person. To the survivors, I would say it's better now as compared to before, because they have somewhere they can access this information from the RCDD website. And also we have champions, we trained 40 champions from the funding we received in this grant. And this included part of the community members, they included the CHPs, the police, the chiefs. So we have a network where people can now get help.
In case of anything wrong, which is not helping, there's a place you can go. There are people you can talk to and we make things better.
And our key aim was to focus on the referral, such that if a champions or someone who is a CHP in the community finds a GBV victim, it's easier to refer to them where they can get the help. So those people who are unsure, maybe, or they have not tested the system, I would encourage them to try, and also encourage them to talk to one of our champions or the people that we have trained in the community. And now they are more empowered to even facilitate the referrals, and they can get the assistance.
Like in my church now, unapata there are some groups who can sit down, discuss about this issue without a shame. I, pastor, I can stand and address that issue without shame.
The people who have used this app, they acknowledge that it has helped them a lot, especially in information, because our platform, what it is, it enables the victims of GBV to seek information where they can be helped. It provides a connection where people can get information from the police, from the church, from the health centers, even from the community, because even CHPs are part of this who are trained. So it becomes very easy now to access this information from the comfort of their mobile phones on digital devices. Bringing all this information has been a game changer in this community.